Okay, good morning. It's nice to be in Canada. The last time I was here, I was a grad student at Michigan State, and my wife and I drove up. And it's amazing how much it's changed. And we have this challenge in our company to walk 10,000 steps a day. So last night I decided to walk Toronto and go to the Eaton Center. Wow, what a great city you have. It's just beautiful. So thanks for the introduction, Gary. And we all kind of, I think, struggle with a lot of the same things. His story and our story, you could take the names off, and it's a struggle. So in the mid-1800s, a guy at Harvard named John Scudder walked into the Museum of Natural History to meet Dr. Agassiz, who was then known as one of the world's leading naturalists. And he met Dr. Agassiz, and Agassiz said, "So what do you want to do?" He said, "I want to be a naturalist." And he said, "So when do you want to get started?" And Scudder said, "Now." So Dr. Agassiz took one of these little fish, a hamelin, off of the shelf, put it in a little tin can, and told Scudder one thing. He said, "Look at your fish." And of course, Scudder, as he writes about this, was a little perplexed. And he said, "What do you mean, look at your fish?" He said, "Look at your fish, and over time I'll come back by and have you describe what you see." And so Scudder recites that after 10 minutes, he was done. He said, "I'd seen all about that fish I cared to see and all I thought that there was to see." And so he went to look for Dr. Agassiz, and Dr. Agassiz had left the building. 3 hours later, Dr. Agassiz comes back and he says, "John, what have you seen?" And so John starts reciting what he had seen about this fish. And Dr. Agassiz said, "You're not looking." Now, these fish are little. And after 3 hours, Scudder hadn't seen what Agassiz wanted him to see, which is really interesting. And he said, "So what do you want me to do?" He said, "Look at your fish. I'll see you tomorrow. Go home and think about your fish." And so, you'd think this is kind of a funny story. And so I thought, wow, that's a pretty interesting read. And so Scudder goes home, thinks about his fish. He comes back the next day, he gets a pencil out, he draws the fish. He puts his finger down its mouth, he counts every scale. After 3 days of this type of work, Agassiz comes back and he explains to him that he was writing down, he was drawing the fish. And he said, "Okay, you've done a great job. Pretty good job." He said, "Well, now what do you want me to do?" "Keep looking at your fish." Now, this is after 3 days, and this is in a lab, which I find very interesting, but he had brought this fish out of its natural environment. This is a hamelin in its real environment, and maybe this wasn't available in the mid-1800s, but it reflects a little bit about what we do. So they had taken this fish out of its natural environment, put it in a tin can, poured formaldehyde on it, but yet I thought if Scudder would have wanted to really be a naturalist and understand this fish, he needed to go scuba diving. And so I thought, okay, lab work is really important. And when I read through these stories, and I like to do this a lot, is like, okay, what's the parallel in healthcare? And this is the parallel in healthcare. This is our formaldehyde lab. This is what I call. And so I've got this little thing that I think about in healthcare. I call it the 3 C's of innovation and design disease. And it's conference rooms, conference calls, and cubes. And my struggle with it, and I've worked for GE and for Siemens and McKesson, so I've seen this problem up close and uncomfortable. And so we bring clinicians and even patients outside of where they actually swim, where they live. We bring them into these beautiful conference rooms, and this was in one of our buildings that some of our friends built for us. It's beautiful. It's a creative room. It's an innovation room. It's actually in our transformation lab. And so we bring docs out of the context of where they see patients, and we ask them to tell us what they need in that room. And if you know how the brain works, and actually I wish mine worked a little better, but we can't recite what we do in excruciating enough detail for someone to build a solution that will help us in the context of where we practice. We can't do it. There's a wonderful book on this, Thinking Fast and Slow by Daniel Kahneman. And system 1 of your brain wants to make a habit out of everything, and system 2 is the thinking part. Well, people can't think about what they're doing outside of the context of where they are. But this is what we do. And there's so many examples of this in the design of software, in the design of devices, in the design of processes, where we've just been wasting a hoot load of money and time bringing people into a lab versus living in their lab. And so part of the reason that we created Design for People is to get into situations like this. These are two pictures from inside of our system where our ethnographers and I went out to do some observations. The one on the left is a GI lab in the northern part of our state. And you think about that, think, okay, what's so interesting about that? Look at the wires. Look at those wires. The nurses had to string those wires up over all of the systems because the room wasn't designed to be safe. No one thought about this. The architects who designed this room clearly had the best CAD software in the world to do this. They're top-notch architects out of San Francisco. They've designed many hospitals, and yet we're still having to run wires over the top of that. And what happened is we designed these rooms without observing the nurses and the techs and the docs in this GI setting. And so there are workarounds. Now look at the one on the right. This is an allergy and immunology setting. And if you look at it really closely, look where the keyboard is. Isn't that interesting? Look where the sharps are. Now the really crazy thing about this room is this is only half of the room. Invert the picture and there's another nurse sitting behind this nurse and her station looks exactly the same. They bump into each other. They literally have to warn each other when the other one is moving. And you think, okay, that's interesting, but not really. That room is not designed for people. That room is designed for wires and computer cables and cabinets. It's not designed for people. And my argument is I actually think we can do both. Because we often get so caught up in this world of innovation around a widget or around what something looks like on a screen, but we forget that it needs to work for the people versus the people being crammed into this like a fish into a tin can. And this is within our own system, and we're starting to think about this a bit more as we watch clinician burnout go up. You start thinking, what's causing this? And Todd's argument is that it's because we're innovating without the people involved. As we've got the 3 C's of disease down pretty well. And so I'm thinking, well, maybe we ought to get into the context and understand what people actually do. If we start there, then our innovation is probably going to be much more successful. So this is a fun slide for me, and this is where you can actually holler out and answer. Anybody know who the little dude is on the right? Yeah, this was the star of the movie Ratatouille. His name is Remy. And by show of hands, how many of you have seen this movie? Or how many? Look at that, it's amazing. How many of your kids have seen it more than once? How many of you own it? I mean, right? Follow me on this one? Okay, this is really interesting. What a lot of people don't know is why this company is so successful. The name of this company is Pixar. Started by a guy named Ed Catmull and John Lasseter, both brilliant guys. But what really makes them incredible is John Lasseter. Ed's amazing. Computer graphics was really started by him at the University of Utah back in the 60s and 70s. So the team came to John and said, we want to make a movie about a Parisian chef who happens to be a rat. And they were pretty intrigued by the idea, and they said, okay, that's okay, now go do your research. And this is what they say before every movie, go do your research. So they sent teams to Paris to dine in Michelin 4-star restaurants, God bless them, but they worked in the kitchens too, and they filmed the angles of the elbows of the sous chefs. They recorded the sound of the pots and the pans and the dishes. They literally looked at the angles of the lighting. They listened to the accents as the people came to the tables and in what order. What does the setting look like? They did all of this in excruciating detail for weeks and weeks. And on top of it, what else did they do? They literally walked in the sewers. This is not made up. This isn't fable. They literally walked in the sewers to better understand the movement of rats. It's like, are you kidding me? For a movie? They do this for a movie. Yes, they do this for a movie because they have a goal. They want the movie to be authentic, which will entertain you enough that you will want to hire that movie more than once and you'll stay loyal to them. They do this for every single movie. Monsters, Inc., how many of you have seen that one? Lo and behold, they actually went and lived in dives at colleges and they looked at gum under chairs and graffiti on walls so that when you watched the movie, you thought you were having a real experience. And this is for a movie. This is the baffling part. Now, Procter & Gamble, most of you probably used a product or two of theirs. In the late 90s, they were in Mexico and they were losing. They had a product called Ariel Ultra. And it was number 8 in the market. And this is when AG was running the company, and he and Jack were good friends. And they had this thing, they wanted to be number 1 or number 2 in the market. And they could not understand why these scientists in Cincinnati in their lab, who had developed the best water usage and cleaning enzyme on the face of the planet, why they couldn't translate that into something selling in Mexico City. And so one of their brilliant leaders said, well, why don't we go live with the people who are using the product in Mexico City? So they taught people how to be ethnographers, and they literally went and lived with one of the couples highlighted in AG's book, Game Changer, Carlos and Marta. Well, in that culture, Marta did all the laundry. But what P&G didn't know in Cincinnati, Ohio, is that Marta had to walk and get her water, that she had very little space on her shelf. They had done research on that, so they designed this little bitty box that would fit on the shelf. Well, lo and behold, after they did laundry with Marta for a long time and walked and got water with her, they figured out that it was a 6-step process to do laundry. They'd have to do it, rinse it, do it, rinse it, do it, rinse it. And because these enzymes are so efficient, they didn't have suds in them. So Marta didn't believe it was getting clean because her old one had suds, and the suds had an aroma, and the aroma told Marta that she was getting clothes clean for her kids. And so after all this research, they took Ariel Ultra off the market. And if you use Downy 2-in-1 single rinse today, you can thank homework in Carlos and Marta's apartment in Mexico City. Well, what you can also thank is 2-in-1 shampoo. Anytime you see 2-in-1, it's because Procter & Gamble got out of Cincinnati, out of their lab, and they went to actually where people live and work and play and learn and pray. And they figured out what they needed to do. And so you think, okay, so what? If companies are doing this for movies about a rat who wants to be a chef, and if Procter & Gamble's doing this, and oh, by the way, they will pay you to let them come live in your home and do floors with you and windows with you and laundry with you, etc. And there are a lot of interesting stories around that. IKEA will do it. Lego has done it. So many companies in consumer products are doing this, and we're doing this in movies. My wonder has always been, why in the world aren't we doing this in healthcare? I don't get it. I mean, I'm even saying that for Intermountain. I don't get it. I didn't get it when I worked for GE. We're building software in labs and not watching in the context of care. And I'm not being critical of GE. It's a wonderful company. But that process is broken, and we need to make it better. And therefore, we'll innovate much more effectively. So that's why we created Design for People. It was off of this itch that I wasn't able to scratch for a long time. We had all these wonderful people, smart people, building things that the people who were supposed to use them were saying no to. It's like, no, I don't like this. This is too cumbersome. It gets in the way of me interacting with patients. I can't do my job effectively. And I couldn't figure out why. And then it's the 3 C's. And so what Design for People is a program to teach anybody. You don't have to be a social science researcher how to go into the context of care and observe people working. And how do you understand what you see, and then how do you make sense of it in a way that you can actually build a device or improve a piece of software? And that's what Design for People is. And at the very center of it is people. I mean, it's intentionally named that way. I originally thought of Design for Outcomes or Design for Care. And then we sat around with a few clinicians like, no. This is all about people, so let's call it Design for People. But it's a methodical process for how we do it, which it almost seems a contrarian notion to innovation, but we'll get there too. That's not a contrarian notion. So there are a couple of principles that this is based on. So I believe to be a great innovator, one thing is you have to have is a mindset. And the basis of it all is empathy. If there's ever an industry, and especially if you're a provider, a payer, I don't care what you are, empathy is at the heart of healthcare around the globe from my perspective. I mean, I've worked for Cisco Systems in Silicon Valley. There's not a lot of empathy in that company. And I don't say that rudely, but that's just not at the heart of the way that company thinks. It's not intended to be, but healthcare is. And so I love Roger Ebert's quote, it's essential to civilization. I would argue that it's essential to great innovation because it starts trying to understand the people you're designing for. And then there's another little fun one. For those of you who have kids, you may have had one of your kids do this, your grandkids, or you've seen a neighbor. It's curiosity. The thing that often worries me is we get so stuck in hugging and loving the status quo that we forget to be curious. We forget to be empathetic because we just think that the status quo is okay. And then we forget to be curious because we think we already have the answers. Well, we don't. We might have an answer that was efficient enough for yesterday, but we likely don't have the right answers. And Gary and I were talking about this. What are the right answers for 3 to 5 years out? And if we're empathetic and we're curious, I believe that we can figure those things out. I really do. And so this kind of leads me to my definition of innovation. And it's related to the work that Clay has been doing. Fortunately, he's on our board of directors and has been a pretty good pal of mine for quite a while. He has this theory. And by the way, so you need a mindset, and I also believe you need a theory for understanding the causality of innovation. And it's this theory of the job to be done. And you think, okay, I have a job. All right, it's a bit of a different way of thinking about it, but the job to be done, a job is just the progress that someone is trying to make in a particular circumstance. And I think that the key word is circumstance. Could have called it context. So what progress are we trying to make in that context? And there are 3 dimensions of it. And the first one is where we usually get stuck, and this is the functional job. What is the task I'm trying to do or the problem I'm trying to solve? And we really get hung up on that. And that's natural. That's why we innovate and build so many widgets, is because it's all about the function. But the second part of this is the emotional dimension, and how do I want to feel when I'm doing that job? And I'll give you a couple of examples in a minute of really what that means. And then the third dimension of it is the social dimension, is how do I want to be perceived when I'm doing the job? And I'll give a couple of examples that explains why it's so important to have a theory of causality. Because if you take the time to go into the context of where people live, work, learn, pray, and play, and you have a theory that helps you understand the causal reasons of why people are doing what they're doing, how they want to feel when they're doing it, and how they want to be perceived, then you can start allocating your innovation time and money a little bit more effectively. And so the theory of jobs to be done is at the heart of design for people for us. It gives us a systematic way of understanding what people do. Okay, who in here has ridden Uber? Okay, most of us probably know what that is. The functional job of Uber, how does that differ from a taxi or a hired limo? Any guesses? It doesn't. It's just moving people from A to B. That's all it's frankly doing. You can get a taxi and get here. You can get the train and get here. You can hire a limo and get here. If you got enough money, you could take a helicopter from the airport and get here. It's up to you, but you're just moving A to B. That's the functional job. Well, what the guys at Uber figured out really well are the emotional and the social dimensions of the 2 groups that they work with, who hire them to do something. And those are drivers and riders. So every time I get in an Uber, I interview the driver. I want to know why the driver is driving for Uber, not a taxi. And so I was in Chicago last year for HIMSS, and I get into the back of this $85,000 Cadillac. And it's Uber. And so I asked the guy, it's like, hey, I'm that aggravating guy that gets in the car and wants to talk to you. I said, hey, man, I got some questions for you. Why do you drive for Uber? He said, it's a job. I said, no. Why do you drive for Uber, not a taxi? Do you make more money? He said, no. I'm thinking, well, why would you do that? And so I said, but so why do you do it? He said, well, because when I drive for a taxi, I have to pay $100 a day, whether I drive or not. And I have to drive a 12-hour shift. I don't have any flexibility in my shift. And so I thought, uh-oh, I'm beginning to get this. The emotional dimension of letting me dictate my own schedule. That's a freedom perspective, right? And then he said, I really don't mind driving up in my driveway either in an $85,000 Cadillac when I used to pay for a cab. And so it dawned on me, oh, rather than paying for the cab, you're driving a Cadillac. He said, yeah. And he said, my neighbors are really kind of jealous, which he was really kind of being funny, but that was the social dimension of driving for Uber. It was really interesting. And I said, well, why else do you really do it? He said, I take my kids to school in the morning, and I pick them up in the afternoon. I drive when I want to drive. So it wasn't just about the freedom of him driving, it was about the job that he's trying to do as a dad. And so all of these dimensions started coming into play, and he said, you know what else is? I know who I'm picking up. I know what your rider rating is. You're a 4.9 out of 5, and so I'm comfortable picking you up. I know you're okay because all of the other drivers have reviewed you. So I've got this social pressure as a rider to be a good guy when I get in the car. And he said, and by the way, I don't have to worry with your credit card either. It's like, that's right, because my credit card's in the cloud. And he said when he drove a cab, he'd have some frat guys in Chicago just jump out and not pay him. And it was really funny. He said, I don't care when you jump out. It's like, okay, I got it. He said, I'm going to get paid regardless of whether you jump in and out. Or by the way, if you cancel your trip, I'm still going to get paid if you cancel within 5 minutes of when I come to get you. And if you look at those, all of those are emotional or social dimensions of why he hired Uber to be his employer, not a taxi. And so then you think about it as a rider. I know who's coming to pick me up. I can pick the level of quality of a car that I want to have. I know the rater. I know his rating, right? I know it. If he does not keeping his car clean, I get to see the comments. And I never have to give them my credit card, ever. I don't have to worry about my credit card being stolen. That's happened twice, once in New York and once in Boston. And what's really interesting is that it's a social dimension for me too. I went to Boston, I took my son because I was lecturing at Harvard, and I thought, okay, I'm a cool dad because I get to go do that. But I thought it would be really cool. I'm going to order Uber Black, and we're going to go to Fenway. And we're going to go on a tour. I'm a big ball fan, by the way, go Jays. And so I get this Uber Black. So what's my son doing? He's taking a selfie that his dad has taken him to Fenway in Uber Black. So this is like the social dimension of ordering Uber and the emotional dimension for me to feel like a cool dad. And Uber let me do that. And for my assistant back at work, she loves Uber. Because when I travel, I don't do well with receipts. I don't know if any of you guys have the same problem. But you get home, you get in trouble because you don't have a receipt, and then your card goes on hot because the company says, where's your receipt? Well, Uber emails my receipts to my assistant. I don't have to worry about keeping up with them. I mean, it's so simple. But the reason that Uber is now valued at $60 billion and cab companies are going out of business is not because they do a better functional job of A to B. They have solved the social and emotional dimensions of travel better than anybody. Largest ground transportation company in the world, they don't own a car. Think about that for a minute. It's a very different business model, which we'll talk about too. So this is a room at one of our clinics. Now we're going to talk about that lens, that theoretical lens that Clay has about a room. So I went into this room 2 years ago. I'll be 50 next year. A couple years ago, I got this little itch and decided I'd watched too many Jason Bourne movies, I think, and decided I wanted to take Krav Maga lessons. So I did. I blew my knee, and I go in and I sit on that paper. That paper's horrible, isn't it? That's like the worst thing. And but it's designed for one reason, a functional job of protecting the bed. That's what it is. But if you go into some offices, doctors use it as a drawing board. They do. They write on it. I went into a GP's office and he writes on it, right? He writes my scores for cholesterol, whatever. But my buddy Mike Holmstrom comes in, who is a knee surgeon, and he's on this little green stool, and he rolls up to the bed, and he brings out a piece of paper, and he starts drawing my knee. And so I said, Mike, why did you hire a piece of paper to draw my knee? And he looks at me, he's like, what do you mean, why did I hire a piece of paper? Well, my x-rays were up on the wall where you can't see just above the line. I said, well, why didn't you hire the x-rays to explain it to me? And what does he say? Because when I'm drawing, I'm looking at you. I can interact with you. I can watch your body language. I know by watching you if you understand this or not. So I do this so we can have a dialogue. It's not a functional job. It's emotional. He ignored the x-rays and used an old school piece of paper and a blue pen to explain my knee. And he says, Todd, I've actually done knee replacements where they brought the other piece of paper back 10 years later and said, is this what you're doing? So there's this deep emotional connection between Mike and me, and although we were already friends, it was pretty cool. And so then I said, okay, so why aren't you doing all the documentation that you're supposed to do as my doc? I was kind of being a little funny with him. And he said, what did he do? What happens when he turns around to type? He turns his back to me. And he says almost verbatim, I didn't want to be perceived as a doc who turns his back on their patients just to type in a computer. And I thought, bingo, we got it wrong. We designed that entire room around the functional job. We know the angles, we know where the bed will fit, we know where the computer ought to fit because we can run the wires cheaper, we can run the power differently, the door fits there. The whole bit is all functional. So if you're an architect in the room, I believe you can do both. This isn't an or conversation in my mind, it is an and. I believe we can design the rooms for the social and the emotional dimensions as well so that the docs and the clinicians get the level of interaction that they want with us and that we want with them. I truly believe that. I think we can figure this out. There are a lot of bright people in the world. But if you just look at the way we design things, where do we design them? In a conference room, on a conference call, and then someone in a cube with a CAD piece of software. And we're not out immersing ourselves in the world of how things actually happen because we don't ask and we don't watch. And so that's a really interesting way to think about how you understand innovation. So I have this definition of innovation. And by the way, if you Google it, you'll get 500 and something million references to innovation in 470 milliseconds. If you then filter to books, you'll get 552,000 titles. So no wonder we're all as confused as it gets, right? And so I just have this definition that hopefully is Southern simple, and I grew up in the southern part of the states in Georgia. But innovation is just taking an idea to a meaningful or measurable outcome for someone who has a job to be done. You decide what the innovation should look like. We get too caught up in Clay's model of disruptive and all that. Just forget that for a minute. Just think about the people and the job that they're trying to do, and how do you take an idea to a meaningful or measurable outcome for them. And once we figure that out, the rest will come. So one of the struggles that we have in the world of innovation, and maybe all of you have experienced this as an operator, as an innovator, is building a bridge between the two groups. How do you do this? If you're an innovator, you're a tax on an operator. Not trying to be rude, but you're really a tax because you got to allocate some of that operating money to innovate. And so from the theory of the jobs to be done, from the mindset of empathy and the program of design for people, especially now we're going to change gears a little bit to the startup world, you got to have tools that help you know what to do. You really do. And so I'm a big fan of a few tools. You're not going to be able to read this. I'm just going to put this up there just so you get it. My friend Alex Osterwalder did his doctoral thesis in Lucerne, Switzerland, because he had an itch, he had a scratch. He couldn't understand why so many brilliant people were writing so many business plans that actually flopped. He was struggling with it. And it's because, and especially if you work in a big company, a business plan is written on things that you know. Things that you know. And so you'll often see when big companies try to do a startup inside, they try to take the same tools that they use to do a product extension, which is easy because you already know the customers and the channels and the price, and you name it, you know it. So all you're really doing is writing down what you know and forecasting it to some reasonable guess. And you're usually right within a couple of points. You really are. But when it comes to doing something new, old tools don't work. Because what do you know about a startup? Other than it's crazy. But what do you really know? Not much. If it's a completely new business or a new model, you really don't know. And so this tool is called the Business Model Canvas. And Alex wrote this book back in 2010 called Business Model Generation. And what it says is, you don't really know, so let's build the Lego blocks of a business and let's write everything down as if they are a hypothesis. And when I initially read this, I thought, okay, this makes sense. Medicine is based on a scientific method. I have a hypothesis, I design an experiment, I run a test, I get insights, and I go through a learning loop. And by the way, if you're an innovator, and this is Todd's opinion, and it's not meant to be too prickly, but I wouldn't use this term fail fast. I think it's nuts. Alex and I argued over this like two little kids. When he was writing his second book, I was like, Alex, the term failure was coined in 1635. It's kind of funny. It happens to be the year Harvard was invented too, or created. But It has such a cultural connotation that we're not going to let go of it. And the word failure doesn't fit in healthcare. We're not here to fail. So I say, how can you learn fast? Just tell me how you learn. And so what this business model has you do, from the middle to the value proposition to the customer segment on the right, to the relationships, to the channels, and to the revenue on the bottom, it has you write down everything you assume you know. And then behind it, you have to write an experiment. Now, on the left side of the canvas, which is where the operating part of this comes into play, it asks you, what are the key activities you have to do to deliver the value proposition? What are the key resources that you need to deliver that? And by the way, I hate the word resources for people, because people are people. I remember in the 5th grade, I know it's a weird thing, my brain works weird like this. On the left side of my 5th grade book, I remember resources, and I remember it being wind and wood and all these other things. I never remember it saying people. And so I think this resource thing is a little crazy. So people are people. If you need people, say you need people. They're not resources. And then you may need IP. You may need something else. And then who's your key partner? And it makes someone map out their assumptions. And why is that important? Because if you're an innovator, all of your operators have clinical process models. They have protocols. They have order sets. That world is orderly, and it needs to be. And then here comes a bunch of crazy guys like Todd with this helter-skelter idea without a way to write out how I'm going to learn and get the evidence that I need. It's really an evidence-based approach to innovation. It forces you into a discipline. Is it slower? Yes. But it doesn't matter how fast you run or how fast you pour the water if the sponge can't absorb it. So this is a great tool for aligning with the operating engine, and it's a great way of vetting a new business model. And then this is his second book. This is the value proposition canvas. It's a drill in of the value proposition in the customer segment from the bigger one. But what this basically says is, what are the jobs that people are trying to get done? What are the pains they want to avoid when they're doing those jobs? And what are the gains they want to get when doing those jobs? And the reason that I say that that's important is if you focus on the circle first, you're focusing in the right place. The left part is you write down what your product offers and you draw lines to see how well it matches to what people want to avoid or what people want to gain when they're doing a job or trying to make progress. But it is a method. And if we had all afternoon, we could dive deeply into these. But it is a method, it is a handbook, and it is a bridge builder to the operating engine unlike anything I've seen because it's logic. By the way, I've seen at least 200 early stage companies this year. Had one email me at 4 o'clock this morning actually. And I make them fill this out. You want to work with us? Fill that out. Fill it out. I want to know what you know or what you think you know about what's going on in the context of clinical care. And most of them don't, just to be candid. Most of them haven't worked in a clinical setting, so they think that the clinical settings are kind of don't know what they're doing and aren't solving problems right. Put them in the real context and it confuses them. But make them fill it out just to test their understanding before you ever spend time with them or think about a pilot. I also make them fill this out. This is what we call a competitor diagram. I make them put their company in the middle, and then they have to write out everything they compete with. If you've read Clayton's story of a milkshake, milkshakes compete with bananas, they compete with bagels, they compete with a sausage biscuit, they compete. Well, a lot of companies think that, oh, if I'm a milkshake, I only compete with other milkshakes. And so when a software vendor or someone comes to you, they only think they're competing with something that's exactly alike. It's not a greyhound race. And so if you make them write this out, they'll say, yeah, but that's not fair. You'll go look at my competitors. Like, if you don't think I'm going to do that anyway, you're kind of crazy. And so if you just want to make it easy for us to talk to you, go ahead. If you don't want to do this, then go away. I know that sounds really rude. It's not intended to be rude. What it's intended to do is put discipline around an undisciplined world of innovation today. But they're tools. Remember, it's an order set. It's a protocol for how you vet innovation, because you got the theory right, you got the mindset right, the skill set of observations. Now you got to have a tool set to vet them. So in the few minutes, I wanted to leave time for questions. There's a way to really understand people. I like to watch National Geographic because I like documentaries. And they filmed so much about it. My good friend is the CEO of TELUS International, just right here, Jeff Puritt. And he grew up the first couple of years of his life in Tanzania, living with the Maru tribe. Because his dad was doing a dissertation, so they went and lived with this tribe for 2 years to understand them. Walked with them, farmed with them, learned Swahili. They did all of that. And they basically wrote a documentary. Well, now we get to film documentaries. We stay with tribes and other people for 2 years. And I've always wondered, why aren't we doing more of this in healthcare? If we want to figure out what to design for people to stay healthier at home, what if some way we figured out through all these privacy rules how we could go live with them for a day or two? And we go to the store with them, and we ride with the home care nurse, and we go talk to their families and see what their families have to go through to help them live healthy. And then we understand all the nuances of the functional, social, and emotional jobs, and we get that input in reality. We get it in the context, not in the 3 C's. The 3 C's are really bad. I mean, I can't tell you how many billions of dollars have been wasted on the 3 C's. So my challenge to us all is, one, get the mindset right. And I think we've got it. I think we're empathetic and we're curious. The next one is to get a theory. You don't have to pick Clay's theories. It's just kind of simple. And it works. Then teach people how to observe, even how to observe themselves, how to observe their teams. And you can work with your local universities. They have anthropology groups. They have social scientists. We're going to be partnering with the University of Utah with this to get people out of their research groups to work with us. And we're kind of competitors, but not at the human level, we're not. And then you got to have a tool set. And for startups, even to start in, I really recommend Alex's tools and Steve Blank's methods. But my challenge to us is why don't we go film a documentary? Before we try to hand requirements over to an IS group, why don't we go film a documentary and let them go with us to really understand what's going on in an OR or a GI lab or a GP office or someone's home? Because then they'll understand the context, and whatever they build will be fit to the problem, because handwritten requirements are just not thorough enough. They just aren't. So that's my challenge to us all. And I'll end with this one. This is Harriet Tubman. She's one of my heroes in life. If you know who she is, she's the lady who started the Underground Railroad. Brave soul. Some argue that she is the real reason that slavery was abolished. Abraham Lincoln just signed it. And so she has this quote, and I think this relates to us, and I always read it because I would hate to miss what she said. Every great dream begins with a dreamer. Always remember you have within you the strength, the passion, the patience and the passion to reach for the stars to change the world. I think this is in healthcare. I genuinely believe we have the strength to do this. It's a fatiguing industry, but yet I believe we have it. And I believe we have it because we're empathetic. That's our passion piece of it. We're persistent, frankly, because we're all here, right? We're not going away. But that's my challenge to us, is to think about how to get out of the 3 C's of disease of design in healthcare, add the context to it, because then all of a sudden those are a wonderful, wonderful concoction of innovation and design, but take the time to use the theory to understand the functional, social, and emotional dimensions, just like the design of that room for Mike, or a device. And then if we do that, I actually think our innovation dollars will be better spent. And I think we will see better models that eventually will help reduce the cost of healthcare over time. Thank you.